most important, this is tracheal tube. Just look here, you have to identify it. From start to end I am showing. Because living anatomy is a practical subject, it's not a theoretical subject. So this is tracheal tube. Again, learn to identify. I'm just proceeding from one end to another end. You can see a better picture now. I'm telling you the steps how Viva proceeds. During living anatomy spot, you have identified tracheal tube. Immediately you have written, they ask identify and write use. You have written the use, that is maintenance of or establishment of patent airway. I am repeating what you have to write in the spot. Establishment of patent airway. Now, instrument you have already seen. I have shown you the instrument, that is most important. Now you can identify instrument. Now after instrument, Viva straightway goes to trachea. Again, where trachea starts at the level of larynx. Where it ends by dividing into two primary bronchi. Again, where trachea starts at the level of larynx and ends at the level of pulmonary, at the level of dividing into primary bronchi. So from larynx to primary bronchi, I am repeating, from larynx to primary bronchi, from larynx to primary bronchi, from larynx to primary bronchi. Now blood supply of trachea, examiner asks, that is inferior thyroid artery. So trachea is supplied by which artery? That is inferior thyroid artery. One question on development. It begins in second month. So one question on blood supply, one question on development, and one question on histology, that is hyaline cartilage. So one question, blood supply, that is inferior thyroid artery, development from second month. And what is histology? There are 16 to 20 tracheal rings. Of course, hyaline cartilage. So hyaline cartilage में आपको दो point बताना है, two finger technique, that is perichondrium and chondrocytes. The way I am telling you, Viva proceeds. Now, what is asked in theory? That is short answer question. What are relations of trachea? Of course, this is at the level of C7. At which level I am showing? That is C7. What I am showing, that is trachea at the center. Look here. This is trachea. Now, what is, this is from anterior to posterior. Look, this relation is from anterior to posterior. Most important, never forget strap muscles. So, strap muscles, that is anterior. Yes, you may write its relation with carotid sheath, that is asked, or sometimes it is not required, that is internal jugular vein, common carotid artery, and vagus nerve. You may write or you may not write, but most important, you must write strap muscles. Strap muscles, of course we are going to describe what are strap muscles. Then never forget esophagus. This is, sometimes O is not there in spelling, it is spelled as esophagus. So relations of trachea, this is trachea, of course I made it in center. Again, how we have proceeded? Of course, we have identified instrument. From instrument, we have gone to general Viva. In general Viva, we have covered blood supply, that is inferior thyroid artery. In short, development and histology, that is hyaline cartilage, 2 points, that is perichondrium and chondrocytes. From there, look at the arrow. We have proceeded to short answer question, because in YouTube video, I want to cover practical and theory. So practical, I have already shown you the demonstration of the tube. Now in theory, the relations of trachea. So this is trachea, strap muscle, esophagus at the level of C7. Anyway, I'm just going to revise what I have done. Yes, what we have done. First, we have identified the tube. Now, examiner will ask where trachea starts from larynx, where trachea ends Yes, by dividing into two primary bronchi, two finger technique from larynx to primary bronchi. Then examiner may proceed its blood supply, that is inferior thyroid artery, branches from inferior thyroid artery, development second month. And what cartilage? That is hyaline cartilage. So this is the first part of वाइवा. Now this is SAQ. Remember, ये यहाँ तक वाइवा खत्म होता है. वाइवा कहाँ खत्म होता है? यहाँ पे वाइवा खत्म होता है और यहाँ पे SAQ शुरू होता है. सो यहाँ पे थियरी शुरू होता है. सो हम प्रैक्टिकल की ओर से थियरी की ओर जा रहे हैं. लुक एट माई फिंगर, लुक एट माई हैंड, हाउ आई एम प्रोसीडिंग. सो फ्रॉम प्रैक्टिकल you identified two finger technique from larynx to primary bronchi. Yes, inferior thyroid second month and hyaline cartilage. I am repeating, inferior thyroid, that is blood supply, second month, that is embryological aspect, and hyaline cartilage, that is histology. Yes, inferior thyroid, that is blood supply, second month, that is development, and hyaline cartilage. And from there, that is short answer question, relations of trachea. कम से कम क्या लिखना है? कुछ भी नहीं याद रहता है तो इसोफेगस लिखना है. C7 लिखना है, नंबर याद रहेगा. C7 इसोफेगस. एंड नेवर फॉरगेट स्ट्रैप मसल्स. आई एम रिपीटिंग, स्ट्रैप मसल्स, स्ट्रैप मसल्स, स्ट्रैप मसल्स, स्ट्रैप मसल्स. इसोफेगस, इसोफेगस. अगेन थ्री फिंगर टेक्निक, कम से कम लिखना है. स्ट्रैप मसल्स, इसोफेगस, C7. शॉर्ट आंसर क्वेश्चन में 3 पॉइंट कौन से लिखने हैं? स्ट्रैप मसल्स, इसोफेगस, C7. आई एम रिपीटिंग, स्ट्रैप मसल्स, इसोफेगस, C7. अगेन आई एम रिपीटिंग, स्ट्रैप मसल्स, इसोफेगस, C7. ऑफ कोर्स अदर पॉइंट्स like carotid sheath, common carotid artery, internal jugular vein, vagus nerve, you may write, you may not write. Peritracheal fascia, you may write, you may not write. But these are most important points. So how we have done, what we have done to summarize the lecture, we started from practical with the identification of tube और practical की ओर से हम theory की ओर मुड़ गए. अभी इसके बाद आता है क्वेश्चन, व्हाट इज ट्रकियोस्टॉमी. आई वांट स्टूडेंट टू रीड दैट बिकॉज दैट इज अप्लाइड क्वेश्चन. रिमेंबर, ट्रकिया इज मोस्ट इंपॉर्टेंट, स्पेशली सर्वाइकल ट्रकिया, बिकॉज दिस इज फर्स्ट BDS कोर्स. So this video is specifically for first BDS. Rarely they ask thoracic part of trachea. Rarely they ask thoracic part of trachea. So specially I am focusing cervical part of trachea. So वीडियो शुरू हुआ प्रैक्टिकल से, एंड हुआ थियरी की तरफ. सो फ्रॉम प्रैक्टिकल टू थियरी, फ्रॉम प्रैक्टिकल टू थियरी. अगेन रिपीटेशन इन प्रैक्टिकल. ब्रांचेस inferior thyroid, month second month, which cartilage? Hyaline cartilage. Which cartilage? Hyaline cartilage. 2 points, perichondrium, chondrocyte, perichondrium, chondrocyte. And of course other thing, where it starts, that is larynx, where it ends, dividing into two primary bronchi. Where it ends, it divides into two primary bronchi. I hope you are clear with this.